I'm Dr. J, Director of Cancer Genetics at Ascension St. John, and I'm going to overview genetics and breast cancer. In terms of background, 1 in 8 women, or 12.5% of women, have breast cancer. About half of women are 62 or older when they are affected with breast cancer. Approximately 85% of cancer is sporadic. This category includes multifactorial reasons such as environmental causes. 5 to 10% of cancer is hereditary, meaning a specific gene mutation can be identified and allows other family members to be tested. You may have heard of Oscar-winning actress Angelina Jolie, who found out through genetic testing that she is at high risk for breast and ovarian cancer. She wrote in her New York Times op-ed piece, "My doctors estimated that I had an 87% risk for breast cancer and 50% risk for ovarian cancer, although the risk is different for every woman." Angelina Jolie's mother had ovarian cancer and her aunt had breast cancer. She ultimately decided to undergo a prophylactic bilateral mastectomy and also have her ovaries and fallopian tubes to reduce her risk of cancer. Angelina Jolie had the BRCA test and had the BRCA1 gene mutation. Perhaps the most famous genes are the BRCA1, breast cancer 1 gene, and BRCA2, breast cancer 2 gene. I'd like to discuss some common questions we receive about genetic testing. Who typically gets genetic testing? Genetic testing is recommended for those with a personal or family history of breast cancer at age 45 or younger, a family history of male breast cancer, a family member who may have had ovarian cancer or ovarian cancer and breast cancer, Ashkenazi Jewish ancestry, or a personal or family history of bilateral breast cancer. Approximately 1 in 400 individuals have the BRCA mutation. In Ashkenazi Jewish individuals, the rate is 1 in 40. Because of this, you can appreciate how critical family history is to risk assessment. Besides BRCA, there are other genes known to influence cancer risks, and genetic panels offered today now test for multiple genes associated with hereditary cancers. To conclude, the remaining 5 to 10% of cancer is familial. So even if genetic results are negative, one may still wish to be evaluated by a breast cancer team to discuss risk measures. Why is a genetics consultation important? First, genetic testing may provide a roadmap for a patient to take control of their own personal health and work with providers to ensure they have the best surveillance or prophylactic surgeries. Even for patients who do not have a genetic mutation identified, they may benefit from a risk assessment to evaluate their relative risk for breast cancer and to discuss surveillance options. Next, I would like to discuss the hope of genetics. Shortly after I first started working at Ascension St. John, I had the opportunity to meet Marla Rohana, who was in the documentary Pink and Blue. In this movie, men and women discuss their own personal journeys with cancer and the BRCA mutations and how getting tested impacted them. Ms. Rohana has shared her story publicly. In one news report she relayed, "One of my cousins was diagnosed with breast cancer under the age of 40. Her sister was positive for the BRCA2 mutation, and she had 2 of her aunts that were also positive for breast cancer." She explains her love of her husband and stepsons motivated her to get tested, and she found she was positive for BRCA2 as well. She said, "I didn't get married until I was 44, and I'm blessed with an amazing husband and 2 stepsons, Johnny and Marco. I think it was finding new love in my life and the blessing in having a family. I just knew that I wanted to be here for them." She and her husband weighed her options and decided on surgery at St. John Hospital. She says, "I had my prophylactic mastectomy December 10th, 2013, and 7 years later she's doing well." The hope of genetics is that through knowledge, we can outsmart cancer. We can be around for our loved ones, our sons, our daughters, our sisters, and our husbands. These are the sentiments, a commitment to survival, to be there for family members, that motivates patients who come to me about genetic testing. In addition, many patients don't want their daughters to have to go through the cancer battle that they have gone through. With genetics, we can use measures to evaluate risk and if it would be prudent for a patient or their family members to be monitored more closely for breast cancer and have screening beyond the traditional mammograms. Genetics continues to evolve and advance at a very rapid pace, and we are continuously improving our ability to offer personalized cancer risk assessments and care. Genetic panels today offer up to 84 genes that test for genes beyond BRCA, including PALB2, CHEK2, NBN, RAD50. Thank you.